The most important and the most telling presentation of bladder cancer is hematuria, that is blood in the urine. Viewers, I want to tell that if anybody notices blood in the urine, whatever be the age group is, do not dismiss that it is related to heat or food or anything like that. Everybody with blood in the urine needs to be investigated for what we describe as hematuria workup. Out of 40 out of 100 patients will have a problem that can be either treated or cured. So it is very important that blood in the urine not be dismissed as something else. One of the most common reason why bladder cancer happens is smoking. Going into the bladder cancer is slightly less common compared to other urological cancers, but a very important cancer because in advanced bladder cancer, it can have a deep impact on the patient's quality of life as well as the survival. So it is very important that whenever you find blood in the urine or incidentally diagnosed bladder tumor, be treated immediately. The first step of the treatment is to do an endoscopic procedure where we put a camera in the urine pipe and take the tumor off, and many a times, 80 out of 100 patients, this itself is sufficient as a treatment option. Some patients will require more treatment, such as putting some chemicals in the bladder like mitomycin or BCG, and those patients will be kept on strict follow-up with a periodic checkup of the bladder. Now, in patients where the cancer is going deep into the wall of the bladder, we need to consider something quite more in order to give the life for that patient. That will include removal of the whole bladder called radical cystectomy in men and anterior exentration in women. After the removal of the bladder, how will we look after the urine that is coming out? So we create a situation whereby the urine is diverted into a channel and is brought out of the body called ileal conduit diversion. Or in a younger patient who is willing to cooperate, we can even create a neobladder using the intestine and put it inside and restore the normal pathway for the urine. This is called neobladder formation, and it is made out of the ileal, that is the intestine of the patient. Now, why is it important? Both of them will have an impact on the quality of life of the patient. However, I should also confess that it is important the patient adjusts around it in order to give the best survival, the best longevity for that patient. So the patients who want to undergo these operations can undergo this operation using a traditional method where you do an open surgery or a robotic technology. The differences between the traditional open surgery is that the robotic technology allows a faster and quicker recovery and lesser blood loss. However, it is also important to keep in mind that traditional operations are equally effective for these patients as well. So viewers, my take-home message is that if you notice blood in the urine, beware that it could be a bladder cancer and please do not ignore it.